We continue here. Mental health experts say only 1 in 10 uninsured South Africans have access to mental health care services they need, and that mental health is only a downward spiral in this country. Domestic workers and other low-income earners are in particularly disadvantaged positions. For more on this, I am joined by Mashiane, who's the founder of the United Domestic Workers of South Africa, as well as Dr. Kagisho Maaroganye from the South African Society of Psychiatrists. Pleasure to have you both with us for this very important discussion. Mashiane, I'll start with you. This concept of an empathy audit, how could it improve, especially mental health issues affecting domestic workers specifically? And also, what is this? What's an empathy audit?
Firstly, the national minimum wage, I'll speak about it because it's not a living wage.
Sure.
If domestic workers can get a living wage or better salaries, that can improve their mental health. Most of domestic workers are affected by this because they can't afford to pay for simple food, to have a dinner with their children or a lunch with their family on a Sunday. They can't afford to have that. They are so stressed. They are only, those who are traveling, they are only working for transport. Others, they even borrow money to pay for the transport. Yeah. So life is very difficult. They can't buy food, they can't buy clothes for their children. They feel like life is not worth it because they are working and they are underpaid and they can't afford anything in life. Life is very difficult for many domestic workers.
I'm glad you also give us that context because it's also very important for us to understand specific issues that domestic workers often face. Are we talking here more about a challenge when it comes to their income specifically? Or does it also highlight the kind of working conditions they live under oftentimes?
You know, domestic workers have been affected by mental health for a very long time. I remember in 2009, there was a domestic worker who wanted to take her life and her daughter's life because of the stress, how she was treated by the employer. She was abused verbally, emotionally. She even assaulted her, pushed her from the house. So that's a lot that's happening. Many domestic workers are working under those difficult conditions, and many of them are sick, are depressed, and they are not even aware. And some employers, they are not even aware that domestic workers are sick, because when they are with their employers, they try to play that good worker so that they can make that salary at the end of the day. But in reality, they are suffering. We will hear people saying most of domestic workers are single parents. You'll ask why are they single parents? Because they don't have a social life. Those who are working sleep in, their husbands are not allowed to visit them. Their children are not allowed to visit them. They stay with their families who are with their children. They are happy. They go on holidays while they are stuck there until at the month end. They'll only go once a month at home from Friday and Sunday coming back to work. There's a lot that's happening. They are not even happy with their children. You'll find that they are irritable when they are speaking with their children. They are angry. There's anger. There's all of this. So this has been going on for a long time, and they are not taking it serious, or nobody was noticing or talking about it.
Dr. Maaroganye, let's bring you in. We've heard how Mashiane has articulated some of the challenges specifically facing domestic workers. Are we finding that a lot of them don't know where to go for help, especially considering the fact that many are uninsured?
Yes, indeed. I think a lot of our society doesn't know where to seek help. And in fact, never mind seeking help, they can't even identify within themselves when they've got mental health issues. So for us as doctors, if you can't sleep and if you're not eating well, or you're becoming irritable towards your children, like my colleague was saying, then you start thinking, okay, maybe I've got a mental illness and I need to seek help. So we need to, within ourselves, identify when we've got a problem. But then the question is, where do you go? I think traditionally people think that to get help for your health issues, you need to go to a hospital. But we know that you can still get assistance even if you go to a clinic, where perhaps there's a social worker, there's a psychologist, there's a counselor, and there's a nurse or a doctor. And I think the other thing that we need to educate ourselves is that even social workers and psychologists are important too in terms of providing mental health care. You don't always have to see a doctor. So I think people get discouraged because they think that they have to go to a clinic and maybe the clinic is too far. Then they think that they need to see a doctor and the doctor may only be seen on bookings. But we need to encourage people to self-identify when they're not well and also just go to a local clinic, and then they'll be navigated towards the right help.
But Dr. Maaroganye, how does economic hardship then tie in or relate to mental health? Can it impact people on that level?
No, definitely. I think oftentimes when somebody's depressed, somebody's anxious, somebody's just not doing well in terms of the mental state, there's often a cause behind that. And some of the causes include marital problems, but also the financial burden that we're all going through. Never mind domestic work, but everybody in the country. So not being able to provide for your family, can lead to feelings like guilt, feelings like you're a failure, and even just insecurity because you're always wondering when is the next meal going to come, or how can I provide the next meal. At the same time, family members are also financially distressed, and they come to you because at least you got a salary, but your salary is not that much, and now you have to stretch whatever that you're getting from an employer to cover a whole lot of family members. And disappointing them as well can lead to people feeling anxiety and distress.
Mashiane, as we try to better understand some of the conditions facing domestic workers, maybe let's speak to where they go to for help. Are you finding that more and more domestic workers are either asking for advice from their employer or family? Who do they go for help, really?
A few of them will approach their employers if the employer are approachable. But there are those who don't even have that time to approach employers, who don't have time to speak to families because they are overworked, they are living at their workplaces, they don't have a social life, like I said. So it's very difficult. It will be a good thing if the doctor here and their team can offer their services to domestic workers. I remember last year there was somebody, a fellow from Atlantic Institute, who brought his service from mental health to domestic workers because they don't even have time to go to clinics. Yeah, going to clinic for domestic worker is something else because sometimes you have to choose between your work or the clinic. There are those who when they have to fetch their chronic medication, they send their children. But in this situation, a domestic worker is needed to consult herself and speak to the doctor. Do they have that time? Will employers allow them to go to psychiatrists? Or will they lose their jobs as soon as they say, I've got a problem or I've got a mental issue? The employer will say, out of my gate because I can no longer work with a person like you. The sector itself really, it needs a lot. It needs a lot. As I'm here, I'm with Promise is also affected by the same thing. She was dismissed by the employer. She's refusing to pay her, and she can afford to pay her. She even went to a doctor for depression. The doctor diagnosed her with depression. So it's difficult also to go to doctors where they have to pay for them. And the clinics, they will be told that you must come maybe on the 29th, the psychiatrist will be here on the 29th. And on the 29th, the employer wants you there. So if we can have the doctors who can come into our meetings just once in a while on a Sunday and come to meet the domestic workers for the whole day and give them those counseling, those who need medication or anything. Because I remember with Lebu Mulete, there was a domestic worker who got a letter that she must go to the clinic. She didn't go to the clinic in Val, and she collapsed at work. She called me and told me that I collapsed. They've taken me to the hospital. After she was given a letter to go there, she went to work instead of going to the clinic.
But what makes this relationship between the employer and the domestic workers themselves so fragile? Because it would seem that the door of approaching your employer is often one where it's very difficult to navigate through. Are we finding that domestic workers might find themselves in a situation where the employer themselves might be implicated or in the wrong over how they treat these people?
To be honest, many domestic workers are in this situation because of employers. Yes, it is employers that are pushing domestic workers to end up being this ill. The mental health declining is because of what they are going through, and they are afraid to approach the employers. As I've said, that others are afraid to approach their employers. And in Udosa, that's what we are telling them, how to speak to your employer. You know your employer, when she's very happy telling you about her birthday, that's the time to approach your employer and tell her about the headache that you have every night. Tell your employer about what your children are telling you on your messages, all the problems that you have, because this is supposed to be an intimate relationship. domestic workers are spending most of their time at work, at their employers' houses. So there should be a relationship. They should find a way to speak to the employers. That's what we are trying to do. But there are those who are saying, no, we can't. I have a member also in Val. A gun fell from the wardrobe while she was cleaning and shot at her leg. The employer took her to his own doctor, and that doctor removed that bullet, and she was told not to tell anyone. She's now affected mentally. When I speak to her, she just looks at me like this. And you can see that she wants to say something. She's affected. That's what many domestic workers are going through. And this is a reality.
Dr. Maaroganye, maybe let's also address this culture of fear, where it would seem that it's very difficult for domestic workers to even give an account to their employers about some of the conditions they work under. How do we resolve this issue? How do we make it more normalized for domestic workers to actually seek help, even if it's professional help?
Yes, I think generally there's a stigma towards mental illness. So if you say that, you cannot sleep or you have headaches, the employer tends not to take it seriously, as opposed when you say that I may have high blood pressure or my sugar levels are high or low, so I need to go see a doctor. And oftentimes these two conditions are intertwined. But I think the domestic workers must continue to speak to say, I'm not well, I may collapse, I'm very worried. Can I please have one day to go to the clinic? Now, what we must do when we find the domestic worker at the clinic, we must make full use of this opportunity, because, like Ms. Mashiane was saying, they may not come often. So we need to do screening for mental illness. Even if you're just coming for some blood pressure problem, we must be saying, are you sleeping well? Are you eating well? Are you feeling depressed? Are you feeling anxious? Are you feeling under pressure? And maybe even extend the consultation for a bit of 10 minutes for them to express their feelings. And at that point, immediately start treating them for depression. But it sounds like the employees also are under a lot of pressure, and they're taking it out on the domestic workers, which is very, very unfortunate. And they are not able to sort of get the help that they need. I'm imagining that there's a lot of trauma that the domestic workers are exposed to. And I think maybe in government or in the public sector, we must, like it was said, maybe address them over the weekend and try to do some screening and giving them help that we can, maybe even through this organization.
And speaking about services that are on offer, I mean, oftentimes for somebody who's uninsured, seeing a psychologist or a therapist may be very expensive. Are there free services that a person who is a domestic worker can seek?
Yes. I think it depends on where you are in the country. So some provinces will be more resourced than others. I know in Gauteng, from 3 years ago, there was a lot of registered counselors, a lot of psychologists, medical officers and nurses and social workers employed to work in the community. So basically at the local clinics. So they'll be employed in Tshwane, Western, Sidibeng, Joburg Metro, as well as Ekurhuleni. So in a way, anyone can just go to a clinic and say that, I've got I think I've got a mental illness, can I be seen by someone? And then oftentimes the clinics are more covered by counselors exposed to doctors, but we respect counselors and psychologists in our profession, and they can do a lot of work in terms of containing the condition. And if they can't manage it, then the person will be sent to the doctor. And remember, if the condition is very serious, the person can be seen even within a few days.
And Mashiane, as we start winding down our conversation, we've heard about the options that are available, even if they are for free. But what do you propose, especially having first-hand knowledge of some of these challenges or difficulties that these domestic helpers face? Is there anything that your organization is also proposing to resolve some of these issues?
In this topic, my proposal will go to the Department of Health. As I was saying, that if you can have those doctors who can come once to screen domestic workers, to speak to domestic workers on weekends, where domestic workers can also feel like their human dignity is taken serious. They can sit with their doctors, because to them, it's like something that they can see on TV is not going to happen to them. So if the Department of Health can also intervene in this and come to us, so we sit together, form partnership with them, organize domestic workers in all provinces. It must not only happen here in Gauteng, in all provinces. That can be helpful.